I'm a mother to six. I was brought in to help organize a bunch of volunteers.
Why do you think it was really important for a health board to be created around the Pacific Islander community?
Because our health disparities are huge. We have high diabetes, high cancer rates, high smoking. I'm one of those. And that didn't even account the LGBT community because we have a high population of LGBTQ family members.
With COVID hitting so hard, your community, it's just been a magnifier in so many different ways for these disparities for all sorts of communities. How have you felt that way with the Pacific Islander community too, with COVID? And can you tell me a little bit more about that?
We had a launch party to introduce ourselves to the community in February. And it was like the last event before everything went on lockdown. And the launch party was amazing because it had everybody from different islands there. And it was like the first time everybody was gathered together. And then COVID hit. I froze because I knew our high poverty rates, living in multi-generational homes, we were going to be hit hard. And we don't have translation services like we have Tongan, Samoan, the main languages, with the bigger populations, but the newer communities don't have translation services and there's nobody to certify them. So the first thing was like, well, we have to get translators. We had to find community volunteers, community leaders who were willing to either they were working full time and then still translating for us. They were just giving of themselves. We found community members that went out and started delivering food for people in lockdown because they couldn't go to work and couldn't afford food. So we were using our own paychecks to buy community members food, to buy toilet paper. I was stuffing up toilet paper and hand sanitizer because it was impossible to find hand sanitizer. And then that was another problem too when we dealt with translations, that organizations like county governments wanted it word for word. We can't do word for word. That doesn't work.
So can you take me through the process of trying to work with King County to get this important information translated?
Oh, I went to state first. I went to the state health department and I said, hey, we're going to get hit hard. I promise you we're going to get hit hard. It's coming for us. All of us are essential workers. Our living situations, our poverty rates, everything that's stacked up against us in normal times, the inequities are definitely going to just be hardest on us. And then we decided we have to do something. So I went to state health department and said, we have found 7 translators in all these different languages. There's like 9 main languages here. There could be more. We have these translators. They're willing to give their time. And they said, well, are they certified? And I said, there's no process for certification. Who's going to certify them? And I explained to them that these are community leaders or community volunteers that are trusted in their communities. And that's more important than certification. So there was a battle going back and forth with the state. And then they wanted to communicate directly with our community members, and they're busy. They're trying to get their family situated. They're trying to find hand sanitizer. They're doing all this work in the community. So they weren't receiving emails, and our community doesn't really work on email. Right. We like phone calls. We like visits. We're still old school that way. And then with King County, they were the first ones who actually helped. So they gave us a small budget and we hired a couple of our community members to do translation and help us get the messaging out about COVID.
So King County wasn't quite as big of a stickler on the whole certification that doesn't exist?
No, because King County has more POCs in their ranks working within the system. They understand, they know the community. King County is not perfect, but I credit them most of all. We are a caretaker community. We focus on the village, but I felt bad because our organization is focused on equity. So I have to pay them something. So I was paying them out of my paycheck. And so is some of our staff members. When you're on the island, you take care of each other. It's inherent in our nature to care for others. But when government systems want to abuse that and take advantage of our volunteers, then that's not cute.
I hear you. Is there anything else that you want to share with us today?
The way the system, I think they have 10 minutes that they're allowed to spend with you and you're rushed in and out, I mean, we have to go back to island style care and taking time and listening to each other, just being respectful that that's another human being. And there's a family that loves that person. We have a young girl who ended up having cancer, and it was a battle to get her tested, to find the right test. And I had to yell at the doctor and say, can you treat this child like it's your child? So if we use compassion and empathy and You're in a field that deals with vulnerable people in their times of greatest need. That should be front and center. Somebody is trusting you. You're entrusted with their whole lives. And that person in front of you has this whole village behind them waiting for them. So I'm going to cry. If we could just remember that. And that's not just in my culture. That's a lot of POCs. There's a village behind that person standing.
I love that. I love that imagery. When you're seeing your patient, know that they have a whole village behind them.
Yeah, and that cares for them and wants them to be healthy.
Thank you.